What is the impact of hypertension on cardiovascular system?
Well, among the cardiovascular risk factors is the most prevalent and the most important. Um, the attributable risk of hypertension is very high, even because the prevalence is so high. So absolute risk and prevalence make hypertension the first enemy to defeat.
And are there sex differences in hypertension?
Well, this is why we this is pretty unique. We set an entire session on sex differences because there are sex differences, but you can appreciate this because, as you know, young women tend to have hypotension. When they get old, they become hypertensive, and pretty often the hypertension is more prevalent in women than in men. And the impact on cardiovascular disease is pretty different.
And do we have news about prevention and therapy?
Well, therapy, there are a lot of new compounds in study, but nothing really ready to go to the market. We need a lot of more research. So basically, the only novelty regards invasive procedures, which are not really they have not great evidence to be more effective than a good therapy. But the therapy, the tools we have in our hands are sufficient to control hypertension. So it's important to know how to use them.
What are the take-home messages of this Congress?
Well, measure your blood pressure, go to the doctor, learn to self-measure blood pressure with automatic device, especially in the morning, and check your blood pressure at least 1 time a week if you have high blood pressure.